Welcome to the American Society of Plastic Surgeons Roundtable panel discussion. I'm Kaitlin Clark, and I'm joined by three renowned plastic surgeons and ASPS members. Dr. Jerry Chidester, a board-certified plastic and reconstructive surgeon in South Jordan, Utah. Dr. Ryan Neinstein, a New York City-based board-certified plastic surgeon dedicated to body contouring procedures. And Dr. Stephen Williams, a board-certified plastic surgeon in the San Francisco area and one of the leading experts on the Brazilian butt lift procedure. Dr. Williams is also the president-elect of the American Society of Plastic Surgeons. And today, we're here to set the record straight on what's a fact and what's a myth when it comes to Brazilian butt lifts. So Dr. Williams, let's start off with the very basics. What is a Brazilian butt lift procedure?
Right, so the Brazilian butt lift is the colloquial term, the term we hear when patients come into our office all the time, but what it really means is it means harvesting fat from other places in your body, typically the abdomen, the flanks, the back, and then transferring that fat to hips, the buttocks, and so autologous fat grafting is the more kind of medically correct term.
Mm-hmm. So it's really two procedures in one.
That's correct.
Mm-hmm. And do you feel like that fact kind of gets lost on patients? They think that it's kind of one surgery, but really it's two within one?
I think that sometimes patients think a little bit more about the second part of it. They think more about the fat grafting part and sometimes less about the liposuction part. What we try to emphasize for our patients is the liposuction helps the fat grafting part because you're meeting the patient's expectations by approaching the problem from two different ways, reducing the parts that are too full and volumizing the parts that aren't full enough.
And we've been hearing a lot about this new ultrasound-guided BBL technique. Would you explain what that is?
Yeah, and so I think that ASPS and fat grafting in general has come a long way. I think there's been a lot more thought about how to do the operation safely. Patient safety for all of us is one of the primary things we think about. We want our patients to have good outcomes. And the Brazilian butt lift technique, the procedure itself, has some risks. And the concerns are getting fat inadvertently into the venous system, which can cause very severe complications. And so there have been a number of modifications and studies that have come out to make the procedure more safe. And one of the most recent is using ultrasound in combination with the fat grafting portion of the procedure to make sure that that cannula, the device where we're actually depositing the fat, is in the right space and not near the blood vessels.
And so what can happen if you accidentally hit a blood vessel?
Right, and so sometimes some of those complications can be very small, like extra bruising, maybe less fat uptake, but the thing that we really are concerned about for our patients and for the safety of our patients is fat embolism, because that is potentially fatal. And that's what a lot of the media attention, appropriately so, has been. How do we make this technique safer? And I think that the ASPS has done a very good job in terms of educating our patients, educating practitioners of this operation to make it safer and something that's associated with better outcomes.
Now, Dr. Neinstein, to expand upon that, when the BBL first became popular, it was considered one of the more riskier procedures within the plastic surgery world. What caused it to have this reputation, and how has the procedure kind of evolved to where it is now, which is a totally safe procedure?
Well, I think it's important when you're talking to patients about any type of procedure to take a 30,000 square foot view. And what's the ultimate goal? Is it to get rid of stubborn fat, or is it to totally recreate the shape of their body? And I think when anything comes out new, just like in most dimensions in life, there's a pendulum that swings way too far in one way. So when this procedure kind of came out, things were more aggressive. It was a dramatic, cartoonish-like views, and this is things that were over the top. And in some people really, and still to this day, like that. But what we're settling at now is people are looking for more elegant, refined looks, which is going to make things safer in general. When you're trying to do anything in any type of procedure, in anything in medicine, when you're doing too much, too fast, before the science and data catches up to the demand, things are always going to go astray. There's a lot of people who are doing the research into getting this operation down to something safe, something manageable, something reproducible in any surgeon's hands, and really being conservative with the patients and discussing their ultimate goals. Because what I find in my practice in New York City is when you help people reduce stubborn fat in the flanks or the waist, they really don't need a lot of fat transfer to the buttock to get a nice, elegant, perky lift to the bum that helps them feel better in workout clothes, in form-fitting dresses, and that procedure is incredibly reproducible and safe.
Because that's more about proportion, really, right?
Correct. I think whenever you ask the body to do something it's not really meant to do, you're putting yourself at risk.
Right. And to touch base on the safety procedures, Dr. Williams, in light of these recent news stories that you mentioned, surrounding BBLs, ASPS created an international BBL safety task force, which you helped create. And so what are some of the key learnings that task force found? And, how about the safety measures that you established and the protocols you set in place?
Sure. The first and most important thing is you're going to a board-certified plastic surgeon, because you have to start with an individual that's well-trained, that has the appropriate equipment, the appropriate location to do the surgery, and has an ethical code that we're required to follow. Secondly, you want to go to a practitioner that's done the operation before. As any newer procedure, newer trend kind of catches on, there can be a learning curve, and you don't want to necessarily be part of that learning curve. And so you want to make sure you're having conversations with your patients or with your physician that reflect what your expectations are, what the complications may be, and then what the process itself looks like. And those consultations should be made with a physician, not with the front desk or, your best friend. You need to ask your physician those things. In the operating room, things like cannula size, patient position, the use of ultrasound. There's been some data that supports smaller volumes are safer as well too. But kind of that initial recognition that these more severe complications are occurring when you're below the muscle, when you're through that fascia, potentially injuring those vessels, that recognition itself has really been transformative to make this operation safer, because the understanding now is that we need to be away from that space.
And do you think plastic surgeons are embracing the BBL procedure? I know that some surgeons, stayed away from it a little bit, but do you feel like more plastic surgeons are encompassing this in their practice?
It's a great question. I think that plastic surgeons generally want to meet our patients' expectations and make people happy. And I think that some practices say, I'm more of a facial plastic surgeon. I do facelifts and rhinoplasties. Other plastic surgeons say, I have a body of work that is primarily aesthetic body contouring. And so I think each practice finds its own niche in some ways, and I think each practice in some ways attracts those patients that they perform procedures that those patients are looking for. Anytime there's something that's new, again, there's a learning curve. And American Society of Plastic Surgeon members know that we need to make sure we have the education, the skill set, and the information before doing those. And so I think I commend the practices that were careful and thoughtful before integrating that into their practice to make sure it's safe for their patients.
Dr. Williams and Dr. Chiddy, this is an interesting procedure where it's really, I never learned it in my training.
Right.
I don't think you ever learned it in your training. I don't know many procedures that became so ubiquitous that patients demanded that no one's ever done before. We're kind of working backwards.
Yeah. I think you're exactly right. I think the patient demand has been something that has really driven the procedure. And I also think things like social media and just the kind of continual presence of being able to find things online has really driven a lot of these newer procedures. And as plastic surgeons, our job is to find that safe space where we can meet those expectations and do those procedures, but do it safely.
And Dr. Chiddy, so when it comes to prospective BBL patients, is there a common misconception that patients tend to have about the procedure that you frequently need to correct?
Yeah, I think the three of us here, and we've been talking about education amongst plastic surgeons, but I think a big part of this is educating patients as well. And maybe for me, not necessarily correcting misconceptions, but one, just figuring out what their patients' expectations are, because like you've talked about here, social media is such a drive as to what people expect they're going to have, but they don't see the recovery that's behind all that and the background scenes of what really happens to get there. They see this instantaneous result. The other part of this that I think is actually a big misconception is that a Brazilian butt lift does not have to be extreme. Dr. Neinstein talked about this too. Patients, when we do liposuction around the buttock area, you can really create some really nice defining contours and shape. And using even a minimal amount of fat in a safe amount can really create a nice shape. And so that's a lot of times I'm telling patients they're afraid to ask about the procedure because they've heard about the complications. But also it can be something that's very subtle but can really reshape someone's body in a really good way.
And the important thing to remember is, as board certified plastic surgeons who are trained, this is a new application of an established technique. we've all done fat transfer for facelifts, hand rejuvenation, breast cancer reconstruction. So the principles are the same. The anatomy and sometimes patient expectations change a little bit of how we're doing the procedure, but these are well-established plastic surgery principles.
Just the application is a little bit different,
That's
right?
exactly right.
And so Dr. Neinstein, Dr. Chidi touched on this, but the BBL recovery has a reputation for being just a little bit intense. So would you describe that recovery process?
Yeah, for sure. So I think it's one of the driving factors in many of my patients in New York City, busy, active people, is downtime. So, a lot of the times they're interested in doing a fat transfer, whether it be to the breast or the buttock, along with their liposuction or body contouring procedure. But when I say, hey, you may not be able to sit on your bum for a few weeks, they're like, what do you mean? I got to go to work. Like, I'm happy to take 3 or 4 days off to rest from my liposuction, but they may not want to go to work or go to a restaurant or ride on the subway with a pillow on their bum. So really having that, and I do think the recovery is exponential because I think there's a push and pull of the body. So patients need to be really willing to set more time apart from separating from their work and social activities.
And can you explain a little bit about how fat grafting works? Because you're not necessarily going to maintain the same amount that is initially injected. And if you don't follow the recovery guidelines rigorously, you're going to lose even more. Is that correct?
Well, for the basic level and the way I explain it, and I'm sure everyone has their own ways, I can't take my kidney and put it in someone else, but I can move things around from one part of someone's body to another part. But it really comes down to blood supply. And each little piece of fat that we move has to get its own blood supply or own blood vessel, or a little pipe has to grow through. And the more you put in, the harder it is for each of those little pipes to get into the center. If you have a pile of tennis balls, the tennis balls in the middle are going to be, tougher for those little pipes to grow in. So less is more for many things in life, many things in plastic surgery, less is more. And as the more you put in, the less likely that the blood supply is going to reconnect and that's going to survive and live. So when patients want a higher volume, I tell them they're going to have more loss, and lower volume, they're going to have less loss.
I can actually just add on to that,
Yeah.
just because I think, and I'm sure you feel the same way, that is such an important discussion to have, because a lot of times patients, again, they're coming in with expectations that sometimes are shaped by social media or things that their friends are telling them, and they say, well, this is exactly what I want, and here's the picture. And, again, within what's safe, those are the parameters we have to work with, but the more, particularly for fat transfer, the more aggressive beyond a certain amount you're trying to do, you're just not able to retain that fat. And not only that, but your complications go up as well too. Maybe not the really serious ones like death, but oil cysts, contour deformities, additional loss of fat or asymmetry that can cause asymmetries. And so that stepwise approach is really important for patients to hear. And they should understand that when a plastic surgeon says, here are the other things we should consider, the plastic surgeon is looking out for them. We want to make patients happy. We want to meet every expectation and satisfy every cosmetic goal for our patients, but we want to do it safely. And so I think that's a really important point.
And I think sometimes one thing to consider as well is sometimes also patients, you may need to do this in several stages or rounds.
Absolutely.
It may not be safe to do all at once. We can only take out a certain amount of volume at one time safely. Again, we're talking about how much can you put in that's going to stay and be safe. And so if there's a certain look that patient is going for, again, setting expectations and just saying this may take 2 sessions, maybe 3 to get to where you want to be. And I think helping patients realize that in the beginning, that helps set the stage for the next several months as they're healing and seeing their results.
That brings me to my next question. So how important is the patient selection process?
I mean, that's paramount. That's the number one thing. And I think that starts for all of us, even before the patient comes into the office. We were talking about this before we started this panel. Really, social media has been an opportunity for a lot of plastic surgeons and other surgeons to showcase their work, but also educate their patient population and show who they are as a personality, and then finding patients that will help match that personality. And so patients, when they come in, I mean, obviously medical, being medically cleared and safe to do all those things, those are all very important. But above all, safety. And so selecting a patient who can have the appropriate expectations and within our own experiences, getting the results that they want, I think trying to align those together is what's most important in selecting a patient.
So who is an ideal candidate, and is there someone who's definitely not an ideal candidate?
Yeah, I think ideal candidate really, when it comes to safety, first off, are they medically fit for this type of surgery? It's typically done under general anesthesia. So patients have to be able to undergo anesthesia, tolerate the surgery. We're putting fluid into their body. We're shifting fat around, moving it to new locations. And so a lot of stuff's happening inside the body that, you have to be medically fit to undergo. Additionally to that, I think, we talked about this, but patient selection, so finding a patient who has reasonable expectations and given, let's say my experience, I can match their expectations. And so I think once you can align all that together, I think you can come up with a really good result for that patient and they can be happy with their results.
And I think patients are looking for, I'm sure in all of our practices, patients are looking for good medical advice. And while a Brazilian butt lift or autologous fat grafting is a tool, it's not always the right tool. It doesn't do a very good job of managing a lot of loose skin. And so if, for example, a patient has a substantial amount of abdominal skin or they're substantially overweight, sometimes those BBL results that they're looking for aren't achievable with that particular operation or with that operation alone. And that's where, as Jerry brought up, sometimes combining those procedures and saying, look, let's do a tummy tuck first. You have plenty of, source for lipografting from other areas of your body, but let's take care of some of the loose skin first and get you closer.
And if someone does have loose skin, is there anything you can do to kind of tighten that up? Or how do you measure a skin's elasticity? Like, how do you know how it's going to react?
That is the holy. So if any of you want to be trillionaires, develop a device that actually substantially tightens skin. And there are a lot of products out there, and I won't name specific things, and we use some of them in our office. But what I tell our patients is, you have to think a little bit logically about it. If there were a tool that just treated loose skin other than resecting it, other than cutting it away, everyone would use that tool. No one would ever do a mastopexy, no one would ever do an abdominoplasty, no one would ever do a facelift. Just use the tool.
Right. Right. And so, Dr. Neinstein, when can a patient expect to see final results of a BBL?
So I think this is a great question because patients want immediate results. But there's an evolution here. So initially there's going to be swelling, which some people love because they get a lot of volume. And then things dissipate, and it's almost like the body regenerates and rejuvenates. So it can take 6 months to a year.
Oh, wow.
And then the way your lifestyle impacts that result will make a big difference as well.
So, like, how?
And I'm sorry, to that point especially, I think, and to your social media point, a lot of times patients come in and say, well, look at this picture of this patient on the table. Look what they look like, or look what they look like, at day 3 after surgery. And I say, that's not what they're going to look like in 3 weeks, in 3 months, in 6 months. And so I think that part of the reason for going to a board-certified plastic surgeon is we're going to give you more honest end results and not kind of do some of those games sometimes that are somewhat misleading for patients.
Do you find that with a BBL, patients need to follow, every patient should be following their recovery instructions, but do you feel like with BBLs it's even more important to maintain the results that you see maybe on the table?
I think every plastic surgery procedure requires people to follow the post-operative results. These are generally elective procedures. And we, at our office in San Francisco, we really emphasize that people find not only the right medical time for them to be healthy enough for the procedure and the right physician partner, but they find the right time in their lives to do that procedure because the recovery is important, the family support is important, being able to financially afford it so that's not an additional stressor. All those things are really important, and I think that's true really for all cosmetic surgery.
Now, Dr. Chiddy, BBL patients are advised to be cautious about sitting. We touched on this, especially for long periods of time. Why is that, and how do you get around that?
So I think this has been brought up, Dr. Neinstein brought this up a little bit, talking about blood flow, right? This is a graft. We're taking fat from one area of the body and transplanting it or moving it to the buttock or the hip dip area. And that fat is very sensitive at that point. It's like if we take a skin graft and put it somewhere else on the body for, let's say, a burn or something. You don't want to be rubbing, putting pressure, because it puts a lot of external things against that fat that will prevent it from getting that blood flow that it needs to survive. So we really, and that's kind of the overall mentality of why we try to offload that. But there actually are plastic surgeons that I know of that let their patients lay on their fat grafting after surgery and have been doing this for years and get great results. And so
I'm one of them.
Yeah, see, so that's what I'm saying. So there is this mentality of that, but in reality, we don't. There's a lot of things we don't know. We try scientifically to see these things, and we know about pressure offloading and I'm sure you tell them at least turn, all those things, but to be safe. And so there are a lot, even within plastic surgery and plastic surgeons, we all have our own little things that we do.
Right. And those things that individually each of us do, those are the things to listen to. So sometimes our patients come in and say, I was on Dr. Shitty's website and he says, I'm like, right, but we're still different. Amazing plastic surgeon, but we've all refined our techniques and our post-op protocols and our pre-op protocols to give our patients the maximum safety and the maximum efficacy to meet their goals. The reason why I don't emphasize, I tell my patients they can't sit, definitely. But laying down, I find that you're spreading more of the body weight out, there's less direct pressure there, and I also think it's difficult for a patient to go to sleep in one position and maintain that. And so sometimes I feel like patients torture themselves trying to say, I woke up on my butt again. I'm like, it's gonna happen, you're fine.
Yeah, we're not as dogmatic in our practice about, you can't sit for 4 weeks or you can't, do anything for 3 months. We really curate it to that individual patient.
100%.
If we transfer a little bit of fat, that's gonna be a big difference between transferring a lot of fat. And each individual person, depending on the procedure they had, they're gonna have a different, result. And I think one of the biggest differences that people want now is they want curated post-operative protocols that for them, not just that piece of paper, here you go, see you in 3 months. They want an active, dynamic healing protocol.
And that's one of the reasons why sometimes travel can be challenging, because even though the tools we have to follow patients post-operatively are better virtually, it does make it sometimes more challenging to make sure that patient's doing well and to make sure that they're following those protocols. And I know that we all obviously have some patients that travel, but I think that if that's something that you're looking for as a patient, it's really important to discuss what the different steps that you have to take being farther away to be supported. I think that's really important.
And if you have a patient that travels to see you, how long do you expect them or ask them to stay in the area?
I would love them to be there for 6 months,
Yeah.
because at 6 months I really consider my results getting relatively close to being finalized.
So they move in with you for 6 months?
I mean, we're there for our patients.
Yeah. You're San Francisco, you have a full house.
That's right. That's right. I think that generally most of the immediate complications you're going to see in the first week or two. I think that issues about contour or fat graft survival, you generally see at 4 to 6 weeks. And so our patients who travel, we really encourage them to at least be available to come back at that 4 to 6 week point. And then after that, I think virtual consultations or virtual follow-up is a much more amenable way to follow these patients.
Is flying a challenge immediately after the procedure? Like, how long would you want to wait?
Yeah, and so the main risk for flying can be the sitting, but sometimes it's more blood clots. And so anytime someone's had general anesthesia, especially where we have them in compression garments, where we're actually compressing some of the the venous system, there's an increased chance of people having DVTs, having those blood clots break off and go to the lungs and creating, again, very serious issues. And so I think with things like tummy tucks, extensive liposuction where we have people in compression garments, we're thinking about that first. And then afterwards, particularly for autologous fat grafting, we are thinking about the sitting and, hey, you're going to be in this tiny chair, you have this pillow, these seats are already really small, how's that going to work?
Yeah, it can't be comfortable.
Yes.
And so as one of the leading experts on the BBL procedure, are there any common misconceptions or myths that you feel like the public has that you would like to set the record straight on?
Well, I think this panel's done a wonderful job of covering a lot of it. I think the main thing is the procedures become more and more safe because physicians are educated, patients are educated, and board-certified plastic surgeons perform this operation better and more safely than anyone else in the world. The second thing is, we encourage our patients to recognize that they're not made out of clay, and there are limitations to some of the things we can achieve. And sometimes, again, as this panel has correctly pointed out, sometimes those things are better to be done in multiple operations from a safety standpoint, and then also from just what's achievable.
And Dr. Neinstein, you mentioned that you customize each person's recovery plan according to their lifestyle. What are factors that you consider when you are creating your custom recovery plan?
Well, a lot of it really going to have to do with, how much recovery are they willing to tolerate? And you have to match the procedure to that. Because someone can tell you, I only have 2 days of downtime. You can't go into the operating room and do something that is going to give them 3 weeks of downtime. Because you're going to have a mismatch in that trust and that, the caring relationship between the doctor and the patient. So it's really matching the operation to the patient's outcome and making sure that they have the appropriate downtime set. So a lot of our patients, I've noticed, are doing small fat transfers because they have very little downtime. So we're talking a couple hundred cc's, aggressive waist sculpting, so they get that nice change between the lower back and the buttock, and just a drop of fat in the butt. That's enough.
And how long of a recovery will that be usually?
We'll tell them that's a full week of no sitting and then back to full activities.
Oh, wow. Do you need a pillow or anything like that still after a week?
We tell them no at that point, because we take a little bit of fat and disperse it over the buttock, and each area there's not a lot of pressure.
Wow. And Dr. Chitty, do you have any final thoughts on common myths or misconceptions about the BBL procedure?
I think we've covered all the main ones, and I think that it's going to be very helpful, when we talk about this. And it's interesting for me to hear, even just the subtle differences that we have in our practices, but overarching, just knowing that the main goal from us as board-certified plastic surgeons is safety, and then matching, like you said, those outcomes is what the patient expectations are. So I think and those are above all the most important things, and a lot of this information is coming from other sources on social media, maybe people who aren't, particularly trained in plastic surgery that are also doing them, and so it's good to be able to at least see the differences and acknowledge those, and then patients can make their own decisions, what's the best for them and the safest for them.
But patients are also, I noticed, they're amenable to education. The social media, Instagram, TikTok, whatever, maybe a beacon. Hey, look at that. That's over the top. That's wild. But maybe they're interested in it. But when they come into your office and start talking about reality, they're amenable to that. They like that. Actually, it's like, oh, okay, crazy. I won't look like that, but I can do something like that. So, there's that paradox of that. It's great that it's out there, but that at the same time, when it comes to you as the surgeon, you need to be the person, the responsible, person in the room, and bring it down to an educational, back and forth relationship.
And
Patients are into that. Yeah.
I agree. And I think the other thing is, plastic surgeons are doing a better and better job putting responsible information out there on social media. And again, I'm with two world-class superstars of social media. And so I think that while we want those patients to come in and have those individual conversations so we can tailor care, it's also our responsibility as plastic surgeons to be out there in those spaces where patients are looking for information and to put good information out there so that our voices can be heard and the patients can have a better, safer outcome.
And on that note, what do you think are the top 3 things that a prospective patient should be looking for in a plastic surgeon for this procedure or asking their plastic surgeon?
Yeah, so board certification, absolutely. Having experience with the procedure. And then I think, again, as my co-panelists have very eloquently stated, really that connection, that interaction, because patient expectations, us being able to communicate effectively what the post-op care is, all those things are based on a relationship. And being able to communicate back and forth is incredibly critical. So I think those 3 things are are true of almost any plastic surgery.
The only thing I would add is really understanding the facility where you're going to have your surgery.
Yeah.
I mean, there is such a wide range of quality facilities. You really want something that's accredited and that's really state-of-the-art, and this is a place that they take real pride in operating.
And I think that that's an important distinction. I think patients should be very wary or ask some extra questions when they don't meet the plastic surgeon when they come to the office. When they say, well, you'll meet them the day of surgery, that is a red flag. That's not what's supposed to happen. And
It's like meeting at the altar.
right, exactly.
There's shows on that.
Or when patients are going to facilities that are unaccredited, or when facilities like, well, we have 20, not hospitals obviously, but we have an ambulatory surgery center where we have doctors fly in and they fly out, and we're not sure who's there that day. That's a little bit odd. I think most of us have our own dedicated places that we go, or we go to hospitals that know the procedure, because part of it is also making sure your anesthesiologist is competent and capable, making sure your nursing team is competent and capable. And so, again, we are very fortunate that we've built our own facility. We have our own ORs. We have our own board-certified anesthesiologist to ensure patient safety. I know you guys also
We do the
prioritize
same.
that.
We have nurses who are specializing in infection control, nurses who specialize, and this cohesive team every day is doing the same procedures and recalibrating, taking the data, analyzing everything. How do we optimize everything from airflow to sterility? I mean, there's no detail in surgery, especially in the operating room, in your operating room facility and personnel, that can be overlooked. And that contributes significantly to the safety.
Consistency and all of those things across the board is so important.
And so do you also want to ask about what like worst case scenario, like what the outcome, not the outcome, but what they have in terms of a crash cart, because there are serious risks
So
to this?
we love when our patients ask us questions about, well, what happens if something goes wrong? Fortunately, we have an incredibly strong safety record. A lot of that's discoverable by the public. You can go to the medical board and look up if there have been serious incidences. You can ask the facility about that. But any place where general anesthesia is being done, any place where invasive surgery is being done, there have to be emergency resuscitation services, things for anesthesia emergencies, agreements with hospitals to admit those patients if there is a problem. And again, as part of our board certification and part of our membership with ASPS, we are required to certify that we have all of those safety things in place. And we do that to protect the patients.
Well, thank you so much, Dr. Williams, Dr. Chitty, Dr. Neinstein. Thank you so much.
Thank you.
for having us.